Breastfeeding, also referred as an exquisite personalized drug, can completely act as a lifesaver for both babies as well as their mothers. This is not just a statement but a fact that has been recently reported by a group of scientists based on their researches on breastfeeding from across the world. A report published in the medical journal The Lancet states that more than 823,000 of kids' lives can be saved every year through increased breastfeeding to near universal level, leading to a prevention of death in children under 5 by as much as 13%. It further states that this practice can also prevent deaths of approximately 20,000 mothers due to ovarian and breast cancer. The fact is conclusive: breast milk or breastfeeding is the best nutrition a mother can offer to their newly born baby. It offers remarkable health benefits to both baby and mother. It is particularly designed for catering all nutritional requirements of your child in the initial 6 months of its life. An emeritus professor of epidemiologist at the Federal University of Pelotas in Brazil, Dr. Cesar Victoria, has mentioned in the report that breast milk is the first vaccine a baby receives that helps fight illness and disease. To get maximum benefits from breast milk, it should be offered immediately after the baby's birth and should be sustained for next 6 months, till the time of weaning. In the initial few days of learning about breastfeeding, a number of times mother feels like tossing between their nursing bra and opting for formula milk or bottle. Some mothers get tempted to those advisors who suggest formula milk as equivalent to breast milk. If you also believe that you are not that kind of mother who can succeed in this act, then you must read this content further to discover the numerous benefits breastfeeding offers to the mother as well as her baby. Look what Dr. Jennifer Ashton has to speak over a startling report. Breast milk is far better than formula milk. Mother's milk contains both unsaturated and saturated fats along with cholesterol that is a vital constituent of nerve tissues and brain. The fat of breast milk is easily digestible as compared to formula milk. Breast milk is a great source of minerals and vitamins. Breast milk offers special protective agents to the immune system for fighting health disorders like infections, food allergies, and diarrhea in babies. The immune protective elements of breast milk include lactoferrin. It helps in binding to iron, hence making it unavailable to bacteria and viruses. Lysozymes and milk leukocytes wipe out bacteria and viruses. Secretory IgA, immunoglobulin, also helps in fighting bacteria and viruses. Bifidus factors helps in promoting the growth of vital bacteria in the guts and also limits the growth of health issues causing bacteria. Benefits of breastfeeding for mothers. Breastfeeding helps to reduce the risk of breast cancer in mother by 25%. The fall in the risk of cancer comes with the proportion of the cumulative lifetime extent of breastfeeding. It means the longer the time span in terms of months or years of breastfeeding, the lower the risk of cancer. It also reduces the risk of ovarian and uterine cancer. The actual reason behind the cancer-fighting elements of breastfeeding is the lower level of estrogen during the time of lactation. It is believed that lower level of estrogen stimulates the uterus lining and possibly breast tissue too, that reduces the risk of such tissues becoming cancerous. Such activity, when practiced by mothers, reduces their risk of becoming a victim of osteoporosis. Those mothers who do not breastfeed their babies are at higher risk of osteoporosis as compared to those who do so. It further reduces the risk of hip fractures post-menopause. It has also been stated by several studies that breastfeeding delays the time of ovulation. The longer a woman breastfeeds their baby, higher the chances of a natural gap between two children. Breastfeeding is not only beneficial for mothers in terms of physical health, but it is also beneficial for their mental health. Several studies state that it reduces postpartum depression and anxiety in women. It has been observed that breastfeeding women showed significantly great fat loss by single postpartum as compared to the formula milk feeding mothers. This practice of feeding babies with breast milk helps mothers to reach their pre-pregnancy weight quite easily and quickly. Benefits of breastfeeding for babies. Breastfeeding a baby. Breastfeeding. Source: www.kqed.org. Very nutritious breast milk is germ-free or sterile. It boosts resistance to infections and hence results in lesser incidence of health problems.